Good afternoon. I'm Chan Hwang, board certified in physical medicine and rehabilitation, as well as electrodiagnostic medicine. I have been practicing in the area for 25 years. I've also enjoyed a 22-year affiliation with the Pacific Rehabilitation Centers as a pain physician. And I am president of Lifestyle Community Clinics, which is a 501c3 nonprofit through which my team, including my wife and I, Esther, my wife and I, as well as our team members, we have been promoting a whole food, plant-based diet for our patients for 25 years. And we have a residential lifestyle program in Mossy Rock where we help people. We can have up to 10 or 12 residents there at a time, learn to use principles of nutrition, exercise, hydrotherapy, environmental modification, sleeping adequately, and using their spiritual higher power to achieve better mental as well as physical and emotional health. Today, I would like to talk to you about treating rheumatoid arthritis and lupus using a plant-based diet. Rheumatoid arthritis, or RA, is a chronic systemic inflammatory disease. We don't really know the etiology. And since there is no cure, people are relegated to long-term treatment. And the standard treatment for rheumatoid arthritis, as well as other rheumatic diseases such as psoriatic arthritis and systemic lupus erythematosus, consist of disease-modifying anti-rheumatic drugs, or DMARDs. And we classify DMARDs by class. In the first class, we have conventional synthetic DMARDs, such as methotrexate, sulfasalazine, leflunomide, hydroxychloroquine, azathioprine, cyclosporin, as well as gold compounds. And of course, hydroxychloroquine was recently in the news because of people using it for other reasons. Biologic DMARDs is a second class of DMARDs, and they include tumor necrosis factor inhibitors such as adalimumab, certolizumab, etanercept, golimumab, infliximab, as well as interleukin inhibitors such as anakinra, canakinumab, sirolimus, and tocilizumab, as well as B-cell inhibitors, rituximab, and belimumab, as well as T-cell inhibitors such as abatacept, etc. We have also targeted synthetic disease-modifying anti-rheumatoid drugs such as the Janus kinase inhibitors, or JAK inhibitors, baricitinib, udocitinib, as well as tofacitinib. And there are also phosphodiesterase 4, PDE4, and there is one that I know of, which is apremilast. So it's important to note that not all these medications are appropriate for patients. In fact, many of these have extremely dangerous side effects, including death and infections, and they can have a high toxicity for a lot of people. And so one study shows that 50% of patients with rheumatoid arthritis try complementary and alternative interventions, which show that there is a lack of satisfaction with the conventional treatments that I listed off. And I apologize for, I'm sure that I butchered the pronunciation of at least half of them, if not all. So let's see here. We have a few chat. Oh, okay. I think that was something different. So we'll go on. Let's talk about rheumatoid arthritis treatment. People have thought that maybe omega-3 fatty acids could be useful, but studies don't really bear that out. But we do know that rheumatoid arthritis is very anecdotally, at least, connected with meat. And many doctors have actually noticed that. And it kind of makes sense because meat, as we have heard from all the other presentations, can cause inflammation. There's a lot of organic pollutants, persistent organic pollutants, hormones and whatnot. And so we can see how this could increase the inflammation. So there was a study done by Gary Fraser with the Seventh-day Adventists, and they're a very interesting group of people to study because Seventh-day Adventists don't drink, they don't smoke, but they have a variety of dietary habits. The church does encourage the use of a vegetarian diet, but that is left up to the person. And so some people eat meat. And so they saw that the prevalence of rheumatoid arthritis in Seventh-day Adventists was 50% greater in non-vegetarians. So, I mean, this is huge. If you could find a medication that decreases rheumatoid arthritis by 50%, that would be a very highly successful drug. Now, RA relates to a bacterial antibody level, and one of the things about rheumatoid arthritis patients is that they have higher levels of a gram-negative bacterium called Proteus mirabilis. And these antibodies, when you compare with healthy controls, are significantly higher in people who have rheumatoid arthritis. Now, interestingly, vegetarians have significantly lower mean antibody levels against Proteus mirabilis, which indicates that they don't have as much exposure to Proteus mirabilis. And it kind of makes sense when you think about how meat is processed in the industry. And we won't kind of go into it too much other than to have you know that when they process meat, all parts of the meat get processed together, including the entrails, which would account for the presence of Proteus mirabilis. Now, regarding treatment of rheumatoid arthritis, there was a study done in Lancet, published in Lancet, where they had a controlled trial of a fast of 7 to 10 days, followed by 1 year of a plant-based diet. And what they noticed is that following the fast and then 1 year of eating a plant-based diet, there was decreased joint swelling, decreased pain, increased grip strength, decreased severity of morning stiffness, decreased duration of morning stiffness, decreased severity of limitation in function, decreased number of swollen joints, decreased number of tender joints, and a reduction of Ritchie's articular index. And they did a follow-up study published several years later, showing that these improvements were sustained for 2 years. So it not only lasted a year later, but with the exception of grip strength, which of course depends on how much exercise you do, these improvements were sustained for 2 years after introducing the vegetarian diet. So when you treat persons with rheumatoid arthritis using a vegetarian diet, not only do you get better clinical outcomes, you also see improvements in the laboratory results. So they measured leukocyte count that was decreased, IgM was decreased, rheumatic factor was decreased, complement components C3, C4 were decreased, the ESR was decreased, as well as C-reactive protein. And we already mentioned how Proteus mirabilis goes down. Any questions about rheumatoid arthritis? Yes, Dr. Rao. 7 to 10 days of fasting, followed by a 1-year vegetarian diet. And then the second study was the same people who decided to go on for another year because and many of them did because they felt so much better. And those improvements were sustained. Now the grip strength, you had to keep on exercising. So that part it helps you initially to get there, but then to continue to maintain the grip strength, you did need to use your hands. All right, let's go on to systemic lupus erythematosus. SLE is a chronic multi-system autoimmune rheumatic disease whose symptoms include fatigue, joint and muscle pain, skin lesions, as well as more severe manifestations such as kidney failure, CNS manifestation, psychological manifestation, as well as problems with heart and lungs. And right now, SLE affects about 322,000 adults here in the United States. And more than 90% of new patients presenting with systemic lupus erythematosus are women. There is a genetic predisposition that we are aware of, as well as environmental factors, as well as hormonal milieu. And these all interplay together in the development of the disease that we call systemic lupus erythematosus. In people with SLE, we see accelerated hardening of the arteries, which is a significant comorbidity, and the leading cause of death in women with SLE, as well as the few men who also have it. And one study showed that more than half of the patients with SLE presented 3 or more risk factors for coronary vascular disease, such as obesity, hypertension, and dyslipidemia. And a lot of it is due to the standard treatment, which often uses prednisone. Hypertension, hypercholesterolemia, as well as other risk factors that we mentioned, they all conspire together to give premature atherosclerosis in the SLE cohorts that have been studied by the authors indicated here below. And people with SLE were identified to have 2-fold to 3-fold higher risk of stroke, as well as myocardial infarction. And studies by Stuart Rose and Amanda Strombaum show that a plant-based diet is both safe and efficacious in the treatment of hypertension and coronary artery disease. And so SLE patients who have these risk factors, they also have they're more likely to have metabolic syndrome because a lot of times, as I mentioned before, they have daily glucocorticoid treatment of 10 milligrams of prednisolone equivalent on a daily basis. And so many developed diabetes mellitus. However, those patients who follow a plant-based diet have a 78% reduction of type 2 diabetes mellitus, as well as a 56% reduced risk of developing metabolic syndrome. That is correct. Yes, that's right, Gwen. On Zoom, Amanda is an author on these papers. All right, good question. Thank you, Jeff. Now, lupus nephritis. People who have lupus, about 50% have renal involvement, and a plant-based diet will improve GFR as well as blood urea, nitrogen, and creatinine levels in people with chronic kidney disease. And so this is amazing stuff. I mean, people, this can make huge difference in quality of life of these patients. 67% of people with systemic lupus erythematosus were found to be vitamin D deficient. And so vitamin D supplementation was found to be essential for these patients. And a whole food plant-based diet was studied by Knippenberg, Robinson, and Wincup, in which people who adhere to a whole food plant-based diet were more likely to experience benefit from the dietary change, including a significant decrease in severity of SLE symptoms, especially if their initial symptoms were severe. So Brandon Yang says, a little off topic, but there's plenty strong evidence on the benefits of a whole food plant-based diet for patients with osteoarthritis. Yes, there are. And I recommend, most of my patients actually have osteoarthritis, and this is the diet I recommend to my osteoarthritis patients, and it does help them as well. Thank you for that question. So let's get back to a case study, and this is from Goldner. And this was a study, 6 weeks of raw vegan nutrition in a 24-year-old female with lupus. She was considered a candidate for transplant and maybe will need dialysis till then. Well, she was treated for 6 weeks on a whole food plant-based diet, and her GFR increased from 14 to almost double in just 6 weeks. This is huge, folks. She no longer needed dialysis. She didn't need a kidney transplant either. And furthermore, her energy and joint pain levels also increased significantly. So, you know, this is just amazing. There's a strong body of evidence which shows that a plant-based diet can be beneficial for reducing the mortality as well as morbidity and metabolic risk. And this is so little studied, but we see these things again and again. Now, I hate to say this since I'm also a guy, but they also studied in that same thing, a 41-year-old male. He had lupus as well. And as long as he adhered to a whole food plant-based diet, his symptoms resolved and his tests were normalized, but then he had difficulty adhering to it. And so unfortunately, when he didn't adhere to it, his labs went up again and, he started having symptoms. But it was very clear that as long as he adhered to that whole food plant-based diet, he was doing so well. Thank you. When Gwen says, Gwen Hansen, thank you for that comment. Yeah, if a drug did this stuff, the whole world would know about it. Thank you. That's a very true comment. So yeah, I think guys sort of have a harder time than women when it comes to controlling our appetite. So guys, let's up our game. Anyway, let's talk about pregnancy and lactation in women with systemic lupus erythematosus. About 90%, as we mentioned before, 90% of SLE patients are women and often are of child-rearing age. And so it's really important to note that a well-planned plant-based diet is confirmed to be safe in pregnancy and lactation, as well as conferring additional health advantages such as lower risk of excessive gestational weight gain and preeclampsia. And so we need to help motivate our patients now that we know. I'm sure all of us have patients with RA and SLE. We need to help them motivate for change because they get more healthy, the symptoms improve, and they also report, patients also report that only 24% of their doctors even mention diet. And yet look at what kind of impact the diet can have on people with these kind of pain problems. So I hope that everyone listening will remember these things, that for both these conditions, as well as osteoarthritis, a vegetarian diet reduces the risk of morbidity as well as mortality, especially when it comes to SLE, which does unfortunately cause heart disease and kidney disease. So does RA, for that matter, in severe cases. But let's see here. We have another. Thank you, Gwen. Yes, similar results are for psoriatic arthritis. Yes, and we need to do more research on it. The medications available for these people are very difficult to tolerate, as you all know. But a vegetarian diet does reduce risk of RA as well as SLE, improves renal function, decreases cardiovascular morbidity, and as well as reduces the risk of excessive weight gain and preeclampsia in pregnancy. Thank you so much for your attention.